Hi, my name is Mandy Sorensen. My PICO question for this unit was, in neonates, how does IV glucose compared to oral glucose affect hypoglycemia levels within the first week of life? I learned a lot in this unit from this question. Sometimes you wouldn't think it's exactly what you expected. The themes I came up with was 1, oral glucose is the preferred method. 2, IV dextrose is used for more imperative hypoglycemia levels. And 3, you need to make sure that that you're doing continual monitoring throughout any type of low or high blood pressure levels. And when you're treating those with like glucose and that kind of things, you want to make sure that you're monitoring those often. With my first theme, I chose to do oral glucose as the preferred method. It's less invasive, parents prefer it, and it goes hand in hand with feeding a lot better than IV. When you use the IV treatment method, sometimes placing an IV can cause the neonate more distress, and that's something you definitely don't want to do. And so pediatricians or nurse practitioners will sometimes use the IV dextrose if the baby already has an IV placed for other reasons, but typically we like to use the oral glucose, especially for those that are just kind of not being able to raise their own levels because their body isn't used to making their own glucose or insulin yet. Glucose yet. And so my second theme that I chose to do was continual monitoring. This is just imperative because you want to make sure that the doctors know how the baby's levels are doing. Are they dropping more even with treatment, which means that we need to go to a more invasive treatment, or are we raising the levels too fast, too quick? Because that can cause issues as well. Hypoglycemia is such a critical diagnosis to be aware of in neonates because it can cause serious neuro damage if left alone. I'm going to take this into my practice implications. I'm going to take this into my practice. I want to be a NICU nurse. I want to make sure that I'm monitoring my patients well and effectively, but I also want to make sure that I'm observing my patient. Not every neonate is going to have the same manifestations with hypoglycemia as the baby next to them. So you need to make sure that we're observing our patients as well for any of those manifestations of hypoglycemia. And I'm so thankful that I was able to do this and learn more about hypoglycemia within the NICU community and the neonatal community.